Do it. Okay. Awesome. And oh, I forgot to say this, but it's okay that it's on the recording. But we have that 40-minute block, so we can just, I don't know, we'll figure it out. All right. So, hi, welcome, Perrin. Thank you for being here and sharing your knowledge with us because, again, I know, kind of the superficial and you're just like digging into all the layers. So, I love just kind of having your brain with us for a little bit. So, um,
Absolutely.
I'm going to have you, why don't you just do a short introduction and just kind of a little bit of why you got into some of the work that you do and how you help people every day.
Well, that will take 3 million years. No. Uh, my background is in speech language pathology, myofunctional therapy. I'm a registered yoga teacher and breath coach, and my name is Perrin White, and I'm owner and founder of Breathe Well, Be Well. And essentially, I have a two-prong approach to why I do what I do. One is because this is what my patients need, this is what my clients need, this is what my family needs, this is what my friends need. And the second part is these are things that I have suffered with everything that I absolutely that I treat, and everything that I offer I have physically done myself. I'm constantly looking for ways to improve my airway because it wasn't until I was age 34 that I got my septum fixed, my turbinates reduced, my tonsils removed. And it wasn't until I was actually able to take a full deep breath at age 34 that I realized, oh shit, what else have I been completely wrong about? And what you asked me off air, what's the first thing to attack? And I call it the point of entry. When we're talking about breathing, there are a lot of layers involved. Is it a structural thing? Is it a behavioral thing? Is it an anatomical thing? Is it a physiological thing? Is it an emotional thing? And is it some kind of crazy combination of all of it? Which, by the way, it usually is a combination of all of it, just depending on which age you are. It gives you either more or less in one or two factors. So what I can tell you is I'm the daughter of a dentist. I was a speech language pathologist since 2011, and it took me a long time to come to terms with the fact that I didn't even really know what a tongue tie was, and I didn't know what dysfunction looked like, and I was jacking up my life in all the worst possible ways. So I can tell you what happens when you don't take care of it, and it can lead to Adderall addiction, which it did in my case. It can lead to really poor sleep. It can lead to depression, and what came first, the chicken or the egg? Was the depression there, or was it exasperated by poor sleep? And I don't care. It's probably both and. But what I can tell you is you are not going to make depression any better by not sleeping. And you might be in bed plenty of hours. That was my case, but I never got quality sleep. And you have to really educate yourself on what are you looking for. So 3 rules of the body that I go over with every client, regardless of their age, is one, you are not broken. Your body is functioning the best it can and it's keeping you alive. So if you're alive, if you're able to listen to this recording, you are not broken. Two, your body is talking to you all the time. It might be, hey, you got most likely to fall asleep during graduation. That's a sign you probably should pay attention to. Or you get allergies all the time, or you get ear infections frequently, or you can't swallow pills, or your chest maybe aches, or your muscles feel tight in your mouth. These are messages, very clear messages from your body to pay attention. But rule three, you've got to learn the language of body, the language of your body, and the language of your breath. And that's how you pull them all together. So it really is helpful to find educators and people in your healthcare team that know what they're looking for and understand the scope of the entire airway and your your whole lifetime, and where does it all fit in, and how can it impact in a positive or a detrimental way, and then what do you do about it. So I do what I do because it's what I needed as a child, and I do what I do because I can't treat any other way. These are the foundational skills that are imperative for success. So if you think about Maslow's hierarchy of needs, the very base ground level is physiological safety, and that includes air. And what he was referring to is like, can you actually breathe air? What I'm really concerned about is how are you breathing that air? Because that then changes the whole trajectory of your nervous system and your ability to regulate, your ability to heal, your ability to rest, your ability to actually understand what's happening and then make a choice from a place of empowerment versus a place of scarcity. So I always am going to look at your anatomy. I'm always going to look at your physiology. I'm always going to ask about your emotions and your stress, and we're going to learn how to breathe where you are right now as we slowly unpack what's happening. And what age is the best age? The age you are right now. And understanding that it will look different at any stage that you're in, but the symptoms, you don't grow out of them, you just adapt to them. And I look at a lot of compensatory patterns in the muscles of the face and the mouth when it comes to breathing, speaking, and swallowing. Those are the three functions, the three factors that we evaluate for oral facial myofunctional disorders, or OMDs. That's what a myofunctional therapist specifically can help with. And I love myofunctional therapists that are also speech language pathologists, because they can really get into the swallowing and the speaking components. And then someone who has breathing expertise like myself, or someone that's gone through, my breathing is through my yoga teacher training and Oxygen Advantage, but someone that's done anything like Buteyko breathing, Oxygen Advantage, there's a couple of other ones that are really good. But if you have some understanding of the mechanics of breathing and how we need to get out of like pulling it in through the nose and think more about the diaphragm, I really want you to be a horizontal breather versus a vertical breather, think more 360. So, three things that I wanted to make sure I just right off the bat got into is, what is correct oral rest posture? Two, why does it matter? And three, what can you do about it? So, correct oral rest posture is one of the absolute goals of myofunctional therapy. It's one of the crux that we are really working towards. And it entails a couple of things. One, you want the tip of your tongue to your spot. It's called your incisive papilla. It's where you say na 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 na. You want that anchored to your spot, and then slowly lifting the blade of your tongue fully up to your palate. You want to think about it like a foot filling the sole of a shoe. And if you have ever worn a shoe that's too tight, you know your foot hurts. If you've ever tried to jam your tongue up to your palate and there's not enough room, you get scalloping on your tongue. There's lots of signs when the palate's not wide enough, or there's not enough room, or there's too much tension. But in a perfect world, our tongue is gently, fully sealed up to our palate. Ta-da! If we take a look at a sagittal slice of the face, front, middle, back, fully sealed up. Your teeth are not touching, so I want like a millimeter or two apart. Lips closed.
Okay.
We want that space between the teeth because I don't want any clenching or grinding. The stability comes with the tongue, not from the teeth. Then I'm going to have you gently seal your lips. I don't want any grimacing. None of this. None of this mentalis. I can't really do it well, but like when your chin kind of dimples a little. And I like to say, if you look like you're constipated while you're doing these, you're using too many facial muscles. I don't want to see any like grimacing in the eyebrows, and then shoulders are relaxed. You're breathing in gently, easy through the nose. Ribs are expanding, lungs are filling up. As you exhale, ribs knit back together, belly falls, and it slowly comes out of the nose. This is a full functional breath using correct oral rest posture. And you should be able to do that when you're not eating, talking, or drinking during the day, so that you can carry it over at night. So why does that matter? Why does correct oral rest posture matter? Well, because look at this beautiful tongue. That's not one, two, three, but eight different muscles. Eight different muscles. And all these muscles include this, and also these muscles closest to your airway. So it's called intraoral pressure when you fully seal your tongue blade up to your palate, which is necessary to keep the soft tissue of the oropharyngeal space, basically your throat, open when you breathe in. Because if you're breathing in through your nose, that's negative pressure pulling the air in through the turbinates, all this wonderful gas exchange. Side love note to the nose. Look how much space that is. You wouldn't have that if you weren't supposed to use it. So use your nose. Goes in through the nose, down through the throat, and into the trachea, into the larynx, into the airway. And in order to keep this open, you need the pressure, the light gentle pressure of the seal of the lingual palatal suction, or a tongue cave, to keep this open. You do this during the day so that when you go to sleep at night and you're on your back and you're unconscious and everything's relaxing, you don't get collapse. So if your tongue cannot fully stay sealed, front, middle, back, and specifically the back, because that's what's closest to the airway, if it cannot stay sealed to the roof of your mouth, that's when you either start to get upper airway resistance, meaning this is narrowing, narrowing, narrowing. And if you've ever taken a hose with the water and you've put your finger slightly over the nozzle, the pressure increases of the water that's coming out because you're decreasing the space it has to come out of. The same thing happens here. And you can usually tell when someone is having collapse or mouth breathing or snoring, which happens when there's reduction of that space because their uvula, that basically the piece of tissue that hangs down in the throat, will be really long because it's highly manipulated by the pressures that are occurring during breathing, and especially breathing at night. So if your tongue cannot stay up, specifically the back, that's when you get full collapse, which could be an apnea event. You can get snoring, upper airway resistance, where you start moving around in your sleep, or you get knocked out of sleep. You wake up a lot, maybe you have to use the restroom. And then that essentially leads to either two things. One, your mouth will come open, so you can get that breathing there, or your jaw will start to come forward. That's where clenching and grinding comes in because it's genuinely, you take the skull, it's trying to shift the jaw forward to collect more airway space in the back.
Yep.
Um, and being joined by my dog, my my codependent
Oh
dog.
my gosh.
Uh, so if you can't keep your tongue out of your airway, you're going to hear it. You're going to see the body move. You're going to feel it because you're not going to be rested. You're going to notice you start mouth breathing, you start drooling because your body doesn't want you to die. Like I said, you're not broken and your body will do everything in its power to keep you alive. You will probably end up grinding of some sort
Okay.
and turning to try to get the tongue out of the airway, and you're not going to feel too great. So that's why it specifically matters, like in a nutshell. There's other things like headaches, and you might be bloated, or you might have like coldness or cramping in your fingers because of the lack of blood flow. Not even getting to like the gas exchange that happens from nasal breathing versus mouth breathing. There can also be dental issues. And then once you realize, oh, there's something happening, what do you do about it? I
Mhm.
recommend an orofacial myofunctional evaluation. You want to look at the function. So I love expansion. I honestly am a fan of taking the tonsils out when there's no room because the analogy that I think aligns the most, I don't love it the most, but it's kind of like a blocked or a clogged toilet. There's
Yeah.
You have to get rid of the obstruction.
Mhm.
Otherwise, it does not work and you get a bigger problem. So I think, is it perfect? No, but is it a very viable option? Yes. And go to the ENT. Definitely check out expansion if you're younger. And always, always, always look at the function of the tongue. And I really prefer a myofunctional therapist that also either has speech background and or breathing, some kind of breathing re-education background as well, like myself. So you can either book a discovery call with me. If you're in South Carolina, I can be your speech pathologist. If you're outside of South Carolina, I'm your breath coach. And I basically teach you how to breathe, where to rest your tongue. If it's a child, I do parent training and help you find the other providers because it's never just one provider that's going to fix all of it. It's basically you find the different people that fit the puzzle that is your body, that is your breath, that is the language of what you need. And understanding sometimes you need a lot of help, sometimes you just need a little bit of help. This can include, like I said, ENTs, orthodontists, physical therapists, so getting the rest of the body in alignment. I also am a big fan of body work. So I love Rolfing. I like craniosacral therapy and finding the right chiropractor for you. That's a heavy, that's an umbrella term, knowing that there's a lot of different chiropractors that operate in a lot of different ways. So finding the one that aligns with what your needs are most. But myofunctional therapy, of course, I'm biased because that's what I do. But I want to make sure you know how to breathe, and you know how to breathe not like when you're aware in therapy, but do you know how to breathe when you're talking to your family? Do you know how to breathe when you're scrolling on Instagram? Do you know how to breathe when you're trying to get yourself to go to sleep to create a positive energy hygiene environment or a nasal hygiene environment? Do you know how to unblock your nose? Do you know how to observe when your tongue is not fully sealing up to your palate and how that impacts your breathing? These are all things that I review, and it's because I need them and I continue to need them. And that's the other thing, kind of like you're changing your diet for the new year. You can't just eat one salad or one steak and be like, I hit my protein goals for the rest of my life. It's an ongoing lifestyle. So what I like to tell clients is I don't want you to need me forever, but I want to teach you how to care for yourself and know that you have support so that you can then tackle maybe pelvic floor, or you can then tackle your pain, but you're actually breathing well, so you're not fighting against the pain that you're trying to resolve in the first place. And you might find that some of it maybe goes away, not always, but maybe, and start to focus on how you're breathing and what the pain is then doing. Is it changing? Is it dissipating? Does it feel less severe? And then once you can sleep because you can breathe, everything starts to get a little bit better. And that's hopefully the trajectory that you're always on, is like, how do you make everything a little bit better, a little bit better, a little bit better with manageable outcomes and manageable maintenance?
Yes.
Yeah.
Yeah. Yeah. I love that. And yeah, so interesting that you didn't necessarily even realize and you had all that work done when you were older.
Mhm.
Um,
Mhm.
and yeah, so I think the really cool piece, most of my clients are women. A lot of times they're they're mothers, and so they're kind of looking out for things in their kids. And obviously, my experience with my daughter, where it just kind of like popped the light bulb on because it was very really relative to me. I love this understanding because I think also, if someone works with you and just has that understanding, then they're looking and they're helping their family members, and they're just like reaching out and saying and identifying, hey, this is really important. um and like you said, the nervous system, your body just cares about keeping yourself alive. And so we're trying to get you out of that tension. And so you don't feel like you have to just work plow harder through something. It's more, you feel that restorative breath and the restorative sleep, and you're kind of wiping away that stress every night when you're sleeping instead of amplifying it when you're
Uh,
sleeping.
and I think a good, so yes, and you're all the things you're saying, yes. And actually the client I had this morning was the son of a dentist, and I love working with providers' children because you sometimes need that personal connection to make the light bulb actually go off.
Yeah.
And I told them, I'm not just changing your son's breathing, we're changing the whole family's breathing. And how do you just create a new language of functional breathing and more more resilient being? And it's not even about the stress. Like, the stress will always be there. It's how do you let it affect you, and what do you allow to negatively impact your life? So you need a degree of stress to get shit done, like to make things happen, but you don't want it to be so overwhelming that you don't have a way of getting it out of the body. Like, you just don't want to have it holding on. And
Right.
where I think my Adderall addiction was extremely helpful is just understanding, how does addiction work? Well, it's because the brain gets a new pathway that it feels so strongly attached to because it is so ingrained in your neural pathways, like your actual muscle memory, that it takes too much energy to find a new one. And I think on a much lighter scale and a lighter tense, we're all addicted to breathing quickly. We're all addicted to that. And it's literally called screen apnea, when you hold your breath because you're scrolling because the next thing is so jarring. And it was originally started off as email apnea, where people were like holding their breath while they're reading their emails. But
Mm-hmm.
it's almost like Instagram or social media apnea. There's a lot of components that contribute to poor breathing. And I think you really have to look at all of them and understanding, if you're trying to give a presentation, if you are like in the flow, like, you might have some elevated cortisol levels. And honestly, that's healthy. That's what like helps you complete the task.
And yeah.
And you shift gears when it's then time to go have a lovely dinner with your family and be present with your children or your partner or your friends. And that is the shift. Like, how do you build resilience so that you are okay in every single scenario? Or how do you be a little bit more okay so that you can enjoy life a little bit more?
Hmm. Yeah, yeah, definitely. Um, there was something I was gonna that just brought up a thought with that is, I mean, and that's where you went to, you can experience some of these things if you're essentially, hyperventilating, or because I deal a lot with time with clients, we work on the exhale, right? So like totally being able to get that residual volume out of your lungs in order to then take a nice deep breath. But if you're, not getting oxygen, the oxygen carbon dioxide exchange, you're going to get all of those systemic symptoms. And again, there's a time for that fight or flight, right? And there's a time to kind of come down from it. And what was I going to say? Oh, about the addiction and kind of those patterns, is what I think people don't realize is once those patterns are ingrained, it is more comfortable for your brain to
Oh,
stay with those patterns
yeah,
than
yeah,
make a change. So that goes back to like part
yeah.
of, I like that you keep saying like learn the language, because I often relate some of this practice or like the retraining of the rest of the body to like learning to read or learning a new language or something like that. I don't think we realize that addiction, or say like I'm reading a book about busyness, it's like your brain is literally comfortable in busy mode, and to sit on the porch and enjoy, the sunset and do nothing is like, that's a stressor because it's different and outside. And that's kind of that same path of addiction, or I would say like chronic pain, and how sometimes people just get in the hole of this is me. And, we try to pull that piece out and say, this is just a part of you, so there's not so much, I guess, identification with what you're going through right now. Which I'm just going to circle back to one other thing that you said. You were kind of like, I don't really care, chicken or the egg. Like, I don't necessarily care, but let's kind of move forward and figure out what helps,
Yeah.
because some of my patients, it's like, well, I'm not quite sure what I did, but this hurts. And, and I'm often like, there could be 1,000 reasons, but let's this will help, let's do it and then see, you know what I mean? And it has to be that clear to retrain some of those pathways. So I'm sure you're kind of catching people that want to move too fast or try too many things or go Google searching on the internet, right? And like, should I be doing this? Where it's just like, let's slow down and actually feel. Like I went through when you were talking about that, and I realized it's really hard to stick the back of my tongue up. um, and so again, that's why I'm so glad I have you. So I'm like, I know some of the things, but it's the little things too. And you are able to just describe how to feel that breath, which, I mean, that just like takes it to a different level outside of just, your speech pathology. It's like into that yoga and understanding and feeling your body more. So that's really good.
Well, thanks. Well, and
Yeah.
I was thinking as you're adding this, something that well, one, I keep going back to addiction because I had such a profound experience with it. And part of the reason I became addicted to Adderall is because I wasn't sleeping well and I wasn't breathing properly. And I didn't want to feel because I didn't have the energy to feel. And everyone is on an energy budget. Like you only have so much money to spend each month. You only have so much energy to use at your expense during the day. And if you are constantly have to learn new things, you are going to give out quicker. So you revert back to patterns that are already well established because it takes less energy to complete the task. This is why you don't necessarily think about every step that entails into tying your shoes. Sometimes you might drive to a really familiar location. You're like, I don't even know how I got here.
Mm-hmm.
It
Yeah.
was so far. Like you're not meant to think about every minutia step, which is why we can bundle things and start to stack. Like there's basically habit stacking that you can do, but our brain does this and compresses information for tasks that it already like has deemed it knows how to do. And so if your afternoon activity is always the same, even though it's not a healthy one, it's still a familiar one and it doesn't use as much energy. So when I was given Adderall, I didn't have to worry about being tired and I didn't have to worry about feeling. I just could take a pill and dissociate, which honestly, we all sometimes want to dissociate. And I'm not saying I don't fully not do that now, but it's understanding with intention, but
Yeah.
it took a long time to unlearn the pattern of dissociation and numbing to instead address my feelings and figure out what my body needed. And instead of trying to white knuckle life, to nourish my life and nourish the energy. And then secondly, I've decided you have to choose your provider. So a lot of times, I'm actually not a lot of times. Most of the time I am the right fit for people, but sometimes I'm not. And I was going to say, I don't really love all the providers I've gone to. And as a single female, I still date. Sometimes I take a break from it, but I want you to think about dating your provider in the sense of like, do I choose to go to them? Do I
Mhm.
feel like I'm heard? And if you don't feel like they hear you or at least are listening to you, and they might not fully understand what's happening, but if they're not willing to really take an interest in what personally you are advocating as your why, like I want to be able to feel better, to be able to dance with my daughter and her first dance on her wedding. I want to be able to bend over and lift up my grandchild. I mean, like, what are the big whys? That is what's going to motivate that person. And I try really hard to make sure we understand why are you wanting help so that we can really address that in addition to helping all the other things. But understand that if you don't feel like the provider you're going to is supporting you, go find a new one. Go find a new PT. Her name's Cassie.
Yeah.
See
Yeah.
her and choose the people that choose you.
Mhm.
So those two things I think are really helpful because to make a change, it's going to take some energy. And to make that change long lasting, you've got to have some internal motivation and feel supported and feel empowered that you made the choice. You weren't told, you weren't voluntold, you weren't forced to do it. You decided that you were ready for a new pattern. And that's when you really make lifelong changes to your health.
Yeah, yeah. And it seems like, I mean, you're someone that too that's really, really good at just kind of meeting someone where they're at and then having this, it's very important. This is very important, right? If people don't think that breathing is important, that's silly. But also how it's going to adequately integrate with their life. So it's not just too far outside the realm of like that's too difficult or that's going to take too much time. So it seems like you do a really good job of just like integrating this and just having that conversation of like what are your goals and what do you have space for right now and kind of just being able to make that really really personal. So this is a very important question: how long of either a time period or number of visits would you say kind of is your average? I know that's a hard question. It's a hard question for me too, but
Yeah.
yeah, just
Well,
hit those goals.
I always start with a discovery call, one, so we can figure out are we going to mesh? And
Right.
then if it's a yes, we do an initial evaluation. And from that initial evaluation, I'll create a long-term plan and your short-term little turtle steps. And essentially, I call it breath boot camp. And I want to see you for 4 sessions. That's about every other week because the way it works out is I think it's like 60 days that it takes to actually build a skill and create a new habit. We've got to at least like get some standard structural foundational skills in place, and that's whether you're a child or an adult. And then if you're locally in person, I can refer directly to providers for tongue tie releases, for airway assessments for deviated septums, and then after that it usually is about another 4 sessions to heal from any kind of type surgeries. If you are out of state, then I will help you find the ENT that you need, help you find the dentist, or help you find the in-person providers if I'm not able to support you. But really, it's what your goal and what are you wanting to tackle. So I bare minimum breath boot camp. I want to know, like, are you actually dedicated enough to put the effort in? I will go above and beyond, but I need you to do your part. And after those 4 sessions, let's say there's some serious medical things that also anatomically need help with, it's probably another 4 sessions. So on average, on the low side, it's 8. Sometimes it's 12. I've had some that are younger that have been with me longer, but there's been more issues to work through. And then depending on what your needs are, then we meet like every 3 months or 6 months following that. And I want you to really think of me as your breath coach because you ultimately are in charge of your body, but I want to help guide you in the right way. And I want you to have time to really integrate these practices. But as far as some like short-term goals that I want is I want your tongue to fully seal up to your palate. And usually we can get there. And I wanted to make sure,
Mhm.
usually we can get there within 4 sessions. And I wanted to make sure I said this before. before the call was over. But
Yeah.
when you're younger, we're dealing with development, so oral facial development. When you're older, we're dealing more with stability. And just understand that you need consistent light pressure for 6 hours, 6 consistent hours to get teeth movement. So let's say this is the tongue and this is the palate. Your tongue acts as the palatal expander when you're a child, and your tongue acts as the retainer as an adult. And understand that the roof of the mouth is the floor of the nose. So part of the reason my nose became deviated is because my tongue never fully sealed up to my palate. And if that's the case, then you're going to start getting a more narrow and arched palate. When that happens, it's like the floor of the nose becomes buckled. And so the walls start to kind of cave in. So if the roof of the mouth, the floor of the nose becomes narrow and arched, the septum will then deviate because it doesn't have a steady foundation to anchor into. That then dictates the whole shape of the face. So understanding that if I can at least get you to breathe through your nose, to know how to keep your nose clean, to teach you how to lift your tongue up to your palate, strengthen those muscles individually, that includes lips, jaws, tongue, and then get you to learn how to retrain to unblock your nose, you are at least going to set yourself up for stability and success. And maybe you come back to me, maybe we move forward, but those 4 sessions are crucial.
Mhm.
Then there's a trick I wanted to show you
Yeah.
about tongue rest posture. And this came from Dr. Perry from Stop Chasing Pain. He's a chiropractor on Instagram that does a lot of lymph flow teachings. But listen, we're gonna look really silly, but it works. You raise your eyebrows like you're really smart, like surprised. You smile really big. You put your tongue tip to spot and swallow. And when you feel the back blade of your tongue, the posterior part of your tongue, hit the soft palate, keep your tongue where it is and then soften your face. And this works because we're elevating, elevating the tongue, and then keep your tongue where it is, rest everything else. And you
Mhm.
should feel more activation, more elevation of the posterior blade of your tongue. That is a really simple cue to
Mhm.
start integrating into your daily practice and
Yeah.
see how that changes your oral rest posture.
Yeah. Yeah. No, that was good. And actually, I realize that my palate is probably a little bit more narrow because I see that scalloping, those ridges on my tongue sometimes. And as I do that, I can feel, I don't have enough space.
Well, and what I say all the time is like, we are going to do the best we can with what we have right now. Because I also have scalloping. I also can tell you at age 34, after I had my airway surgery, I also had a tongue tie, lip tie, and buccal ties released. And in the years following, I know I've gotten at least 2 millimeters in width in my palate. Now, is it from tilting of my teeth? I don't know. Is there actual skeletal growth? I don't know. All I know is my tongue is the healthiest it's looked because I'm able to swallow properly. I'm able to rest my tongue in the right place. And I can tell you the shape of my face has changed as an adult. And this is the long game. Like, there are no short fixes. There are some immediate wins, but this is long-term lifestyle changes that are going to help you breathe and sleep and feel good in your body. And what I can tell you is sometimes, yeah, jaw surgery is an option. Sometimes it's not, but we have to train the tongue regardless of
Yeah.
what you do, so it has the best possible chance of keeping you healthy and keeping your airway open. And then there's all sorts of things like tongue scraping. That's why myofunctional therapy comes into play.
Mhm.
Additionally, like changing your diet and the way that you swallow your food is also a big deal because that also moves all the muscles of your tongue as well. I'm realizing we have a minute and 45
Yeah.
seconds.
I know, I know. We're close. I'm just going to make one more
Sure.
connection. I love that you're saying that the tongue is the stability because I mean, most of the time I'm seeing people because of instability somewhere. And so that grinding, that's your teeth looking for that stability. And if it's not coming from your tongue, that's just going to cause loads of pain. So yeah, this was really, really helpful. I learned a lot in just a little bit of time. So thank you so, so much for being here. And I'm gonna make sure that anyone that watches has your information and just send them to your website, do a discovery call, start there, right? And just see if it's a good fit.
Yep.
I
We,
think,
we
I
got
think
that
great.
provider blind date. And do you care if
Yes.
I take a picture of us real quick?
Perfect. No, go right ahead.
All right. Thanks, girl. All right. Have a great